Dr. Rajeev has explained. One is patient is brain dead. That means brain is totally gone, but the heart will be functioning. So that most of the cases after assessment in a healthy person, young person, associated heart is sometimes heart will hold the hole is there, will close, correct it, and the heart can be used in a younger patient. So that is one thing. Other thing is, as he mentioned in Sydney only, first time it was done in 2015. That is, if somebody is brain dead, but the heart is still beating. Heart will beat, oxygen is going into the lungs, still he is breathing spontaneously. In the end, the heart will just stop. So those type of heart, that machine is there, when it supplies oxygenated blood into the heart. So, adile keep giving blood and see how the heart is performing. Some heart may not be usable in this type of hearts, where the heart stops blood itself and resuscitates as the heart. But few of them are usable. So, aduvanda we can get more donors. Because the India on the brain dead only we are using that. If they can get this also passed medically, then we will get more donors. But we need machines to transport, and the machine is there, you can transport for longer distances, and maybe few hours the heart will withstand because blood supply is going into the heart. Whereas at the moment what we are doing is stopping the heart and then transporting it to the nearest place by air and then green corridor. Up to 3-4 hours the heart is stopped already. Other machines probably we will be getting it soon. I think, is it available here?
It's not available.
Not available. So that abroad they put this on the machine and supply blood to the heart. Heart will be not beating because it is like normal. Oxygenated blood is going into the coronary artery, supplying the heart and the muscle. So it will withstand hours of transportation without any problem because of distances, especially I was talking to somebody in the US. So from California to New York, they can transport the heart. Because the whole country, they have only one system. Wherever who is listed in priority, whichever may be the state, the heart will be transported. So effective is the system there. Because people are, so many patients are, whatever artificial resuscitative measures like artificial implantation of artificial heart inside, all those things, artificial pumps inside the heart. Adhikella side effect is there because anticoagulants no battery to be connected from outside. The best treatment of heart failure today is heart transplantation. Because all other things have its own problems. If our artificial heart left ventricular assist device is very expensive. It may cost like 50-75 lakhs. The battery has to be connected outside to work. The patient has to carry that infection blood thinning tablets. So it's sort of there are people living like that, but it's not especially in our situation, it is not as good as the results in other countries because they are very well organized. The transplant is separate department just to look after the patients. Separate cardiologists are there visiting different hospitals. Patients are stationed, follow up. We don't have at present that sort of facilities in our country. So we are doing with the limited facilities what we can do. What is ideal is not practicable. If we wait for an ideal situation, we will never do anything in this country. So we have to modify things and make sure we do things almost the same level in the world. So finance, insurance, all these are big problems. Taking enough medicines, tests are done properly. Because the medicines also are expensive. What happens is unless they can afford to take this medicine, doing a transplant sometimes may not be a good thing also. If they can afford, suddenly their longevity is less. That is why the people living after transplant, taken care of, they can lead a normal life, 20 years, 15 years, a lot of people doing all normal, even mountaineering, playing tennis, all those people are doing.
Sir, any age limit is there?
Age limit as such, it's 65, 65 or
See, that depends. Most probably we prefer taking donors up to 40 years, but beyond 40 years, then we have to assess them further. Up to 50 and 55 we do take.
You are talking about recipient or donor?
Donors. Immunity so that he doesn't develop antibodies against the donor heart. So it's a lifelong treatment.
சார் அந்த ஆர்கன் எவ்வளவு நேரம் டிராவல் ஆச்சு சார்? எவ்வளவு நேரத்துல 4 ஹவர்ஸ்ல ஆபரேட் பண்ணீங்க? கொண்டு வந்தது எவ்வளவு நேரம்? எப்படி கொண்டு வந்தீங்க?
It's within 20 minutes and by road.
எங்க இருந்து எங்க சார்?
So any special permissions ஏதாவது வாங்கிருந்தீங்களா கொண்டு வரதுக்கு?
No, we didn't ask for any permission. It was done in early morning, so we had no issues. No. Like it was early in the morning, so we didn't have any.
From where you harvested this
This is private hospital here within Chennai.
Within Chennai, we are for confidentiality of the donor. We are not supposed to medically tell you where and whose body heart has been. It has been in the city of Chennai only.
Okay.
So we didn't ask for a green channel because the police are willing to give us because it is, I must tell you that Tamil Nadu is the most organized sector in organ transplant. We should be all proud of that. Because
பரம்பரையா வந்து இருக்குன்றாங்க. இதாவது எப்படி அவங்க அப்போ சின்ன வயசுல கண்டுபிடிச்சிருக்காங்க.
cardiomyopathy, you see, cardiomyopathy could be primarily muscle weakness தனியா வரலாம். So many varieties are there. Heart muscle ரொம்ப hypertrophy hypertrophic cardiomyopathy வேற ஒரு விஷயம். That is all genetically acquired only. அப்புறம் வந்து severe valve heart disease வந்துட்டு ஆபரேஷன் பண்ற பேஷண்ட் they go into heart failure. No way we can treat with the medicine. Heart attack வந்துட்டு bypass பண்ண patient heart failure வரலாம். Young patients like 50-year-old, multiple blocks, stenting, 2-3 heart operations, patient with persistent heart failure, we do transplant. Then children with complicated heart problem by birth, they also undergo operations initially because this is the last resort. Heart transplantation, everybody thinking that we put a new heart, everything is fine. It's not like that. As we are telling about the problems related to taking medicines, taking tests and all those things. So we try all the measures because for heart failure, medicines, advanced treatments are there medically, a lot of them we can manage. When the patient is not able to carry out his normal activities with the optimal medications, maximum medicine effective only we are based transplant. It is so there are many indications. Other than this cardiomyopathy is one of them.
Sir,
Everything clear, we put the patient on heart-lung machine. Heart and lungs will stop. So the function of the body is taken by the heart-lung machine. Then we connect the donor heart to the recipient like in the video he showed. And then give blood to this heart. Heart will take over, will disconnect the heart-lung machine. Because heart he has to be alive. At the end of the operation, otherwise patient will be brain dead. All the organs will go. So once we make sure, okay, the donor heart is good, the heart is going to come, say X amount of time. On the way there is no problem, then only we wheel the patient inside, open the chest, put the patient in the heart-lung machine, remove the heart and put it. So that is what the importance of transplant coordinator. They are very important part of this team. We are all in a WhatsApp group. Okay, heart is stopped.
What is the duration, sir?
Whole thing, I think we every 20 minutes.
Explant to implant was around 4.5 hours.
No, the surgery as such was within 1 hour.
Yeah, within an hour we finished. See, to do this operation, the first time you doing the operation is when we do much more complex operations than heart transplant. Technically, it is of course difficult operation, but I won't say it is very complicated, especially when you are doing like a patient who had already had a heart operation, doing a transplant, it is more difficult. When somebody like this boy who comes, usually we finish the stitching in about half an hour to 45 minutes. The actual time we stitch the heart will be 45 minutes in experienced hands. And then we'll have to support the heart. Sometimes, if a transplant you give blood to the heart may not pick up by itself immediately. So, heart-lung machine, the first heart transplant we did to support the patient in another hospital where I was there before. Support the heart for 3 hours. I thought the heart will not pick up. Adillana, heart lung machine, we have got other supporting measures that we can support it for days. Some patients, especially heart, lung, and transplant, we have called ECMO, which was put for our previous chief minister, she was put on that ECMO support. That is available. Life support it is. You can put for 2 weeks, 3 weeks, 1 month. No problem. Heart may recover. So all those support systems are, unfortunately, in our setup, all this comes with a price. It's all expensive measures. Everything is available, we have. So one has to, spend a lot of money for all these things. That is the only thing, because we don't have a health insurance to a large level. These are all, we can't predict. When you accept a patient, we can't predict, okay, X amount of time, X amount it will be over. No. If you are lucky, everything goes well, everything is fine.